Hey, I'm Dorcas and I'm here to give you knowledge about first aid, and I'll start with the introduction part and the rest will follow later. So, first aid is the initial or first assistance given to someone who's suddenly taken ill or injured using generally accepted principles and available materials before handing over to a more responsible and qualified person. And this person who provides this assistance is called a first aider. A person or this first aider does not need much equipment to give first aid. One can improvise anything wherever they are. First aid will do good to yourself, to your neighbor, at school, in church, at your workplace, or even when walking in the streets. This is supposed to be done in a class, especially the practical part. And though times are hard financially and time-wise, busy around the clock, up and down, trying to make end meet, we believe by the end of all our episodes, you will see a good reason to put aside some time to spare and attend a first aid class to the nearest certified institution where you will be able to do practicals and ask many questions that you'll have, and other general emergency questions still that you'll have by the end of these audios. There are many. Though we will do our best to answer the ones you will ask here in our platform. At some point in life, most people will witness or be involved in an accident or a medical emergency, and knowing what to do and when you should call the emergency services can potentially save lives. Many people are hurt, some die, some with permanent injuries every year due to inadequate response or lack of timely assistance. Acting immediately and applying the appropriate techniques while waiting for professional help can considerably reduce deaths, injuries, and disabilities and the impact of disasters and everyday emergencies. First aid is a vital initial step for providing effective and swift action that helps to reduce serious injuries and improve the chances of survival in our community. First aid awareness is lacking in many vulnerable communities where a very basic idea of how to treat an injury or keep someone alive would have real impact. We believe that first aid reduces vulnerabilities and helps build stronger communities. First aiders are needed everywhere in this country so they can help someone before they get to the hospital or while they wait for the emergency services to arrive. It only takes few minutes to die from a heart attack or a blocked airway or loss of blood and other medical and trauma emergencies. And being able to give CPR can prolong life until emergency medical services arrive. And this will increase or can be increasing the chances of recovery and survival. First aiders can quite literally mean the difference between life and death. Now we see how to behave in a scene. We call this scene safety. And when approaching the scene of an accident, always remember to stop, think, and then act. Remember to put on gloves on and introduce yourself, ask for permission, then approach, then get help, and all that you think you need. Check for anything that may be a danger, such as broken glass, body fluids, electricity, gas, or traffic. Remember that scene safety is your primary concern as a first aider. Use all your senses. Use all your senses, look, listen, smell, to decide if it is safe for you to proceed. If anything registers to your mind a possible danger, be it a cloud of smoke, a smell of chemicals, or anything that you see it is not normal or feel it is not okay, please, you will use your common sense and do not become another victim. The first person on the scene of an accident is unlikely to be a trained professional. However, they are still critical to the outcome of the people involved in the accident and possibly for helping to recover the casualties. The hazard involved in the accident could still be a danger to the casualty, as well as other people nearby and even yourself as the first responder. You therefore need to make sure the area is safe before you begin administering first aid. For example, if it's a road accident, you may need to control traffic. While if the incident involved a machine, then it will need to be switched off before attending to the casualties. Assessing the safety of the surrounding is critical when approaching any scene. You do not want to become another person who is injured or ill, so look for any potential dangers. Remove the person from any danger, such as the presence of water, fire, or a collapsing building at the scene. Be especially alert to avoid danger from automobile traffic if the incident is near the road or if it's a road accident. Then call for help if needed. Kwa mfano, you can call Kenya Power, Fire Department, Police Department, or Emergency Services. When you're done with scene safety and get closer to the casualty, it's time to protect yourself and the casualty as well, and any other person who will assist you. So now we see how to protect ourselves from infections. Take steps to avoid cross-infection. Transmitting germs or infection to a casualty or contracting infection from a casualty, it's possible. Cover your own cuts with waterproof dressing and take care not to prick or cut yourself. If gloves are not available, ask the casualty to dress himself or herself or her own wounds, or enclose your hands with clean plastic bag if available. Do wear a plastic apron if you're dealing with large quantities of body fluids, and wear plastic glasses to protect your eyes as well. Do dispose all waste safely and avoid touching wound with your bare hands or touch dressing that will come into contact with a wound. Remember, infection is a risk even with relatively minor injuries. It is a particular concern if you're treating a wound because bloodborne viruses such as hepatitis B and C and HIV may be transmitted by contacting body fluids. The risk increases if an infected person's blood makes contact with yours through a cut or a graze. Usually, taking measures such as wearing disposable gloves and hand washing is essential in the prevention of diseases and illness. Wash your hands after each episode of care and after taking off the gloves. When water is not available, use hand sanitizer. Mostly hand sanitizers are alcohol based and are a substitute for hand washing when needed or when you're out of reach of water. Using personal gear is an important strategy to minimize the risk of blood and bodily fluids exposure. The universal precaution is to use personal protective equipment whenever there is possible exposure to blood or bodily fluids. It reduces the risk for both the rescuer and the injured or the ill person to be exposed to a bloodborne diseases. Gloves protect your hands from exposure to blood and other bodily fluids. Try to avoid or prevent accidental exposure from splashing blood to the eyes, and if eye protection is available, I will request kindly wear them. Be sure to dispose all of equipment that has touched bodily fluids in a biohazard bag when available. When taking off the gloves, avoid touching the outer contaminated surface. Slowly pull one glove off while turning it inside out. Then place the glove in the palm of the other gloved hand. Then place the glove in the palm of the other gloved hand. And then remove the second glove while turning it inside out. So at the end it will be one item. Now we touch on some of responsibility of a first aider. There are many, but I will discuss few. So the main responsibilities are: 1, to manage the incident and ensure the continuing safety of themselves, bystanders, and the casualty. 2nd is assess any casualty and discover the nature and the cause of their injuries and illnesses. The 3rd one is to provide appropriate first aid treatment that they have been trained to do and that is reasonable in the circumstances. The 4th one is, if able, make notes and record observation of all casualties, ideally monitoring vital signs. The 5th one, provide a handover when further medical help arrives. The 6th one is act in a such manner to respect the dignity of all patients and protect their confidential information. 7, inform the safety team of any change of building or room or extension number or your mobile number if yours is off or will go off where you are routinely based. 8 is to keep up to date with training and current knowledge, including any refresher training. For first aid, we do refresher after every 1 year. 9 is assess the situation safely and quickly and call for appropriate help. The 10th one is protect casualties and bystander from possible danger. 11, identify the problems with the casualty as far as possible. 12, give casualty early treatment and start with the serious conditions first. 13, get medical help from more qualified personnel, nurses, doctors, EMTs, and so on. Number 14 is to prevent cross-infection. 15, do not breathe or cough or sneeze over a wound or over casualty. 16 is comfort and reassure your casualty. 17, stay calm and take charge of the situation. 18, remember from the beginning to introduce yourself to them to help them gain their trust in you. Explain the situation and anything you're going to do before you do it. So those are some of the responsibility of first aider to the casualty. Now we see the qualities of a first aider, or a qualities of good first aider. I'll just name few. One is leadership. Two is knowledge of their own limits. Three is good communication skills. Four is ability to work in a team. Five is ability to work under pressure. Six is well-trained and certified. Seven, up-to-date in knowledge and skills. Eight, adaptable to various situations. And ninth one is examined and regularly re-examined. And number 10 is keen and attentive. And lastly, for now, is be a good listener and a well-behaved first aider. Thank you for listening. Goodbye.